Dissociative disorders. Disruption in the usually integrated functions of consciousness, memory, identity of perception of the environment. The disturbance. It may be sudden or gradual to transient or chronic. It is relatively rare in the general population, much more prevalent among those with history of childhood physical and sexual abuse. Dissociation. It's the defense mechanism. It may be pathologically and involuntary.
Types of dissociative disorder. Dissociative amnesia. Inability to recall important personal information, temporary loss of recall memory, or episodic memory. Memory loss more severe than normal forgetfulness, and that cannot be explained by a medical condition. Someone with dissociative amnesia will repeatedly have periods where they cannot remember information about themselves or about events in their past life. They may also forget their talent or skills. Betrayal trauma. Attempts to explain amnesia, the intensity of the trauma, and by the extent that a negative event represents a betrayal by a trusted or needed other the betrayal thought to influence the way in which the event is processed and remembered.
Now, let us categorize these manifestations by each type. First is dissociative amnesia. The client cannot remember important personal information, usually of a traumatic or stressful nature. It can be related also to amnestic disorders, but not accompanied by substance-related, like alcohol and drugs. Acute dissociative amnesia frequently spontaneously resolves once the person is removed to safety from traumatic or overwhelming circumstances. At the other extreme, some patients do develop chronic forms of generalized, continuous, or severe localized amnesia and are profoundly disabled and require high levels of social support.
Etiology of dissociative fugue. Traumatic circumstances such as rape, recurrent childhood sexual abuse, massive social dislocations, and natural disasters, leading to an altered state of consciousness dominated by a wish of flee.
Manifestation of dissociative fugue. Patient with dissociative fugue has episodes of suddenly leaving the home or place of work without any explanation, traveling to another city, and being unable to remember his or her past identity. He or she may also assume new identity. Most fugues are relatively brief, lasting from hours to days. Most individuals appear to recover, although refractory dissociative amnesia may persist in rare cases. Some studies have described recurrent fugue in most individuals presenting with an episode of dissociative fugue. No systemic modern data exists that attempts to differentiate dissociative fugue from dissociative identity disorder with recurrent fugue.
Depersonalization. Persistent or recurrent feeling of detachment or estrangement from oneself. Feeling like an automation or as if in a dream watching himself or herself in a movie. Etiology for depersonalization disorder. First is psychodynamic. Traditional psychodynamic formulations have emphasized the disintegration of the ego or have viewed depersonalization as an effective response in defense of the ego. Next is traumatic stress. Patients in clinical depersonalization case series report series of significant trauma.
Patients with depersonalization disorder has a persistent or recurrent feeling of being detached from his or her mental processes or body. This is accompanied by reality testing, but the patient is not psychotic or out of touch with reality. Other manifestations of the personalization disorder are delirium, wandering, and recurrent or persistent feelings of detachment from body and mind. Depersonalization after traumatic experiences or intoxications commonly remits spontaneously after removal from the traumatic circumstances or ending of the episode of intoxication. Depersonalization disorder itself may have an episodic relapsing and remitting or chronic course. Many patients with chronic depersonalization may have a course characterized by severe impairment in occupational, social, and personal functioning.
Etiology of dissociative identity disorder. It is usually caused of severe experiences of childhood trauma that is usually maltreatment.
Dissociative identity disorder, or also called as multiple personality disorder, includes ordinary forgetfulness, a combination of amnesia and fugue, and can be substance-related and psychotic episodes. Patients with DID displays two or more distinct identities or personality states that recurrently take control of his or her own behavior, accompanied by persons who cannot recall personal information. Some individuals with untreated dissociative identity disorder are thought to continue involvement in abusive relationships or violent subcultures that may result in the traumatization of their children with the potential for additional family transmission of the disorder. Prognosis is poorer in patients with comorbid organic mental disorders, psychotic disorders, and severe medical illnesses. Repeated adult traumas with recurrent episodes of acute stress disorder may severely complicate the clinical course. Psychotherapy, also known as talk therapy or counseling, which is usually needed for the long term. Examples include cognitive therapy and psychoanalysis. A safe environment. Doctors will try to get the person to feel safe and relaxed, which is enough to trigger memory recall in some people with dissociative disorders. Hypnosis may help to recover repressed memories, although this form of treatment for dissociative disorders is considered controversial. Treatment for other disorders. Typically, a person with a dissociative disorder may have other mental health problems such as depression or anxiety. Treatment may include antidepressants or anti-anxiety medications to try to improve the symptoms of the dissociative disorders.